Okay, so if you're wondering why I always do my videos right here, it's because my house has really loud noises. A lot of TVs are on, a lot of people are talking, so yeah. Here's the video. Okay, so this is assessing and treating adult patients with eczema. That's the name of the article. And so the main purpose of this article is to educate nurses on eczema and to help people treat their eczema. But then it also talks about the psychological effects of eczema and how that affects quality of life, which is more what I'm going to be talking about. But yeah, so atopic dermatitis, which is eczema, affects 2 to 10% of adults. So basically, there are different types of eczemas. I don't know if I'm pronouncing them right. So there's exogenous, which is like contact eczema. So when people touch certain things, they get allergic reactions. Yeah. There's endogenous, which is atopic eczema, which is like it's itchy and inflammatory, and it comes like hereditary. So that means that with that, it like comes from your genes, but then you could also with that get asthma and other stuff like that, which is it's kind of common. There's seborrheic eczema, which is common in adults. It creates circle-shaped scattered patches in the skin. There's Pomphylix, which is hand and foot eczema, and there's acetoic eczema, which is for older adults. It's in their lower legs, and it creates like dry, scaly red skin. Oh, and there's lichen simplex, which is areas of eczema that are caused by rubbing and scratching because of like stress factors. So this is a peer-reviewed article, but there really isn't like a methods. It's more like an assessment. So basically, diagnosis of eczema is based on skin appearance, and so sometimes it's required that like it's okay. It's based on skin appearance, and sometimes it's required if the symptoms are severe, or you have to identify the triggers, and you need to know the history of the illnesses to assess eczema. So, like, how long has the person had eczema, where it started, um, operations that the person has had, previous diseases, like their history of allergies, and this includes like family atopy, um, like inheriting conditions, and which is hard to get because family members like they feel an associated stigma with eczema from eczema. Um, and you like to assess eczema, you would also need to know like the person's hobbies. You would need to look at the shape of the lesions on their skin or like the pigment changes, and you would need to see if the skin is like itchy or if it's like painful to the person. There's psychological assessment, which basically quality of life like is affected by the skin disease, and it's considered like part of overall skin assessment, and this is because it affects daily activities, work and interpersonal relationships. um, with eczema comes like a feeling of isolation, anxiety and depression, and this is mainly with severe eczema. There can be low self-esteem, which affects like personal, social, and working relationships. And this article talks about the term dermatology life quality index, which is a tool used to be able to validate like the quality of life of a person with the eczema or the skin condition, which a lot of articles use as well. It talks about treatment. So basically, to treat eczema, you have to find the cause, so you have to identify it and remove it. And because most forms of eczema, like their cause is unknown, so this makes it really hard. And so the skin has two layers, the epidermis and the dermis, right? And so the epidermis protects from irritants, right? But eczema is because like it's mainly caused because the solidity of the lipid barrier in the skin, like it plays a central factor to the development of eczema, right? So so okay, so eczema is very prevalent like in hereditary, like okay, hereditary eczema is very prevalent, but the fact that it's getting like eczema is getting more prevalent now suggests that there's like environmental factors affecting eczema. And so to improve, okay, and then to improve the quality of life of people with eczema, um, because eczema can cause distress for people who find it difficult to cope, like with people staring. And then there's like the constant itch and discomfort that affects everyday activities and sleep comfort. And then like they need to improve their quality of life. They need like time and explanation to like understand how to manage a disease and cope with it. And so there's like a few types of ways to treat it. There's one called emollient therapy, and then there's topical. I can't pronounce it, but it's like corticosteroids, something like that. And those like one of them has to do with like oils and natural stuff, and I think the other one has to do with like a pill that helps to reduce itching. And so results. Basically, eczema has large effects on patients and family. And so the aim of like this article aims to like help nurses help patients with like management, and they want to help them provide info about like their condition and like ways to cope, right? So eczema, obviously, because of like its discomfort, it can cause distress, and so low self-esteem from that, because like it's visible to a lot of people, and people have like a perceived stigma, like they have a stigma with eczema. And then this affects relationships, sleep, work, like participation and everything. And so people are really trying to like find ways to help educate patients that have eczema, because in order when they do that, it helps improve their quality of life.